we are very much disappointed with the county government of Kisii, whereby our members have not been promoted since this government came in. Lastly, they were promoted 2019. Up to date, they have not been promoted. Also, we have issues of shortage. Many nurses have left the country because of poor payment, poor labor issues. They have left, and now we have a shortage of nurses. At least we need more than 1,000 nurses to cover the shortage. Employment, that's an issue. Going to school is an issue. Payment of salaries, delay, like right now, they have not paid the deductions. Bank loans, they are accumulating the interest. So we are asking the county government of Kisii, what are you doing to your members? These are your first soldiers before you go to Mwananchi. These are your first soldiers you put together for better service delivery. I don't know how you can move out and say that services are being delivered from the people who are not motivated. The treat and cover, which was launched recently, it is not working. It's only working in KTRH. Private facilities have refused to give services. Our members are not getting service from treatment and they are deducted money. What we are saying is this: if you are sitting in an office and you are not delivering and you are getting salary, I can say that you are useless and you are not doing anything. Get out of that office and let people come to deliver. When you are not delivering, it means your master is not also delivering. You are showing how your master is. I want to point out to the Department of Health, the Minister for Health, the Chief Officer of Health, if you are seated in those departments and you have not promoted people, you have not employed, no drugs in the hospital, I can tell you, you are wasting taxpayers' money. You cannot move around bragging that you are the Minister of Health and you are not delivering anything. Also, we have the issue. The nurses signed an MOU whereby we were discussing the issues of employment, the reinstatement of the nurses who were illegally dismissed. We agreed, all of us, that these people were illegally dismissed. But you reached somewhere and you ran away, you left us on the tables. I want to tell you, mupende musipende, those people will be back to duty, and it is shameful that the government we supported is not supporting the healthcare workers. So I want to tell you, Wananchi, that if they are not, today is on Tuesday, if they cannot start to promote our members as from now, we are issuing the strike notice. We will only be given a letter of promotion and a designation, even later through this case. Mengine afterward, because you are not obeying court orders, and we are aware that the clinic officers and the doctors went on strike. They were directed by the court to come and negotiate. These people, they have disobeyed the court orders. We will not obey any court order, because if you are not obeying the court order, we will not obey the court orders.
How there on earth? Look at, for example, promotions. How can you take 10 years plus to promote a member from one job group to another? It's quite disappointing. It's a disappointment. It's an embarrassment. Even the church is where we live. Healthcare workers have been disappointed. Members of our families have been disappointed. Now here we are. We are giving a caution to the county government, headed by our Excellency the Governor. Please act.
So we are giving actually the county government of Kisii a notice of 14 days. Kindly honor the memorandum of understanding signed with nurses, honor the return to work formulas of the doctors and clinic officers. As much as time has lapsed, most of the agreements agreed upon were supposed to lapse by 1st September. But with Kisii County, nothing tangible has happened. So kindly, for the next 14 days, do that. If you can't do that, we'll be back to where we were. And as healthcare workers, we don't fear striking. It's more of daring a fish swimming in water. So we are ready for that after 14 days. Please honor those agreements we agreed upon.